Hello, everyone. Thank you for joining our poster for the annual Palliative Care Social Work Conference. My name is Devin Bonatis. I am a social worker at the University of Colorado Hospital in the Cardiac Intensive Care Unit. And my colleague, Kara Thompson, is a nurse care manager for the palliative care program here at the university. We worked together on this collaboration model and practice to integrate more palliative care into our intensive care units, specifically the cardiac and medical ICUs. So overall, we identified this need that although there's lots of research in palliative care within the hospital setting, there still are a lot of barriers to the integration of palliative care for critically ill patients and making sure that we're really providing goal concordant care and addressing some of the moral distress that has been documented for care providers in these settings. So we started working together at identifying when it's most appropriate to have primary versus specialty palliative care consult occur. Myself, as an ICU social worker, we have it structured that there's one social worker per ICU, and it's really a unique position to get to know the nurses and providers and know the culture of that unit as well as the unique psychosocial needs of a particular patient population. And here at the university, we have it structured that our palliative care service is a consult service. So social workers in the ICU are often the ones advocating for that consult to occur or providing that primary palliative care on the unit without the necessity of that consult. So we really looked at in what sort of way is that consult provided and when is it most appropriate. So every day, myself and Kara would run our patient list and really look at the patients that have complex family dynamics or are causing a lot of staff distress, who have had long lengths of stay or have unique cultural considerations, or have been identified by providers as very likely to die in the ICU or need to have a family meeting to address some of the care decisions that need to be made moving forward. So that's what we did. One of the examples of that for the cardiac intensive care unit was patients who require inotrope medications, which is an IV medications that's provided for patients that have advanced heart failure. But the interesting thing about this medication in particular is it's not covered under hospice care. So for a lot of our patients, the goal was to get home for their end of life, but timing of wanting to say goodbye to certain family members or to be in that environment required a lot of coordination to get them safely home and a lot of discussions on the front end about how long can this medication be provided at home appropriately and making sure everyone really understood the unique time frame and that unfortunately it's not something that can be provided indefinitely based on some of those insurance barriers. So through all of this as a social worker, I definitely had gained a lot of skills in some of those specific conversations that are palliative, both primary, but then also on the more secondary complex level of involving our consult service. And I think it also helped us to talk about the culture present in very different intensive care units and which specialties are reluctant to engage palliative care for certain settings or what education can we provide about the unique skills that social workers have in communicating with these patients and families in a culturally competent way. So that was really our collaboration, and it helped us to see that there's not a lot of literature out there about this. And future forward, we would really hope to transition this into a formalized intervention QI project and identify those metrics that would be able to see pre and post an increase of social work knowledge, nursing insight, involvement of a consultation service like palliative care, or just overall palliative care intervention. So that's our hope for the future. If there are any questions for me or Kara, we are happy to answer them. And we thank you again for joining us.